Welcome. Thank you for joining us today. We are excited for our final Lunch and Learn of 2025. It has been an awesome year of Lunch and Learns, and we just appreciate all of you and your support, and for joining us for all these fun Lunch and Learns and different meetings that we've hosted throughout this year. But before we get started, I want to share a quick reminder that our upcoming fall general meeting will be next month. And it's titled Building Resilient Futures, Youth Mental Health in Action. So that's November 13th from 11 to 12:30. And it's a virtual event that will spotlight innovative work from 6 of our regional coalitions focused on child and youth mental health initiatives. So for more information on that, please feel free to visit our website. And if any of your partners or network would like to join that, we'd be happy to send you the calendar invite. So just let us know. And with that said, we're so excited to welcome Courtney King. She is the Research Associate at Georgia Health Policy Center. She'll be sharing an overview of Mindworks Georgia and House Bill 268, which is Georgia's recent legislation on school safety, school climate, and student well-being. Thank you for being with us today, Courtney, and I'll hand it over to you.
Yes, thank you so much for having me. As Alex mentioned, I'm Courtney King. I'm with the Georgia Health Policy Center, and joining me is my colleague Ashley Oliver. She is a senior research associate at the Health Policy Center, and she'll just be here to help field questions, etc. So you can go to the next slide. Perfect. So first, I just want to give a little overview of Mindworks Georgia. So Mindworks is a collaborative of child-serving state agencies, nonprofits, philanthropies, and providers who come together to implement Georgia's behavioral health system of care for children and adolescents. Mindworks, with all of its members, is aligned or is positioned to align people, policy, and practice in order to connect the dots of the behavioral health system of care. I think all of us here know it's a very complex system, and so Mindworks tries to identify the gaps and connect the dots to improve access for children and families. Mindworks is also a formal working group of the Behavioral Health Coordinating Council, which sits under the Department of Behavioral Health and Developmental Disabilities, DBHDD. And Mindworks is charged, like I said, with implementing a strategic plan for Georgia's system of care. And so in 2023, they launched the strategic plan that we are currently in. It's a 3-year strategic plan, and the priority areas are equitable access, sustainable workforce, whole person health, purposeful funding, and system evaluation. Next slide. So before I get into talking about what is actually included in the bill, I just wanted to give a little background on kind of why, this is important, why youth behavioral health is important, especially for school age youth. Mental health needs for children and adolescents have, really exacerbated following the COVID-19 pandemic. And, there's issues with access and stigma and all the things. So I just included a few statistics. So 4 in 5 children with mental health needs receive no treatment. Suicide is the leading cause of death for young people age 5 to 24. 1 in 10 children have a mental health condition that impairs their daily functioning. 1 in 4 high school students report feelings of depression, and elementary students with mental health needs are 3 times more likely to face suspension or expulsion. So this really just highlights the need for the work that we do in ensuring that children can receive the behavioral health services that they need. So now getting into House Bill 268. So following the mass casualty incident in September of 2024 in Winder, Georgia, school safety and school climate were big priorities for the Georgia General Assembly. And coming out of the 2025 legislative session was House Bill 268, which was a comprehensive bill that was focused on, and thanks, Alex, for putting that in the chat. She put the link to the entire bill if you're interested. It's focused on promoting school safety, student well-being, and improved school climate. And the bill includes a lot of things, including mandates around student records and data sharing, behavioral health services in schools, as well as school safety infrastructure. And the General Assembly also appropriated funding for items in HB 268 for the state fiscal year 2026. That includes $108 million to implement or improve school safety infrastructure, as well as around $19 million to DBHCD to establish student mental health support grants, as well as appropriations for specific line items that I'll get into a little bit later. And so the behavioral health components of the bill are critical to the behavioral health system of care in Georgia because it directs the state to really prioritize services across all levels of the continuum with specific highlights on prevention and early intervention. And it recognizes schools as the access point for many children and families. The other key piece of this bill that's really important is that it designates the Department of Behavioral Health and Developmental Disabilities as the state's authority on mental health, and it encourages interagency collaboration. So several other agencies that are responsible for overseeing school safety and services in schools, such as the Department of Education, the Department of Homeland Security, and GMA, are directed specifically to seek guidance and partner and collaborate with DBHCD in implementing behavioral health services in schools. So now I'm going to talk about just what exactly is included in HB 268. As I said, it's a comprehensive bill, and there are a lot of things. So I'm going to kind of break it down into specific categories. So the first is school safety infrastructure. And so there are a couple of things. So the bill requires that schools implement mobile panic alert systems in order to improve coordination between law enforcement officers and first responders. And it also requires schools to procure school mapping data so that law enforcement officers are able to, and first responders are able to see the layout of the school prior to entering the building whenever needed. And that is where the $108 million in the state fiscal year 2026 budget will go to support. The next kind of item is education assurance. So the bill ensures that children in state custody, including if a child is in a psychiatric residential treatment facility or a PRTF, if they're in a juvenile justice placement or foster care, that those kids can enroll in public schools and receive appropriate education as well as special education services. It also creates procedures. It kind of addresses school attendance by creating procedures for following up with students who stop attending school consecutively for 30 days. And then it also revises some definitions related to the juvenile code, including definitions of aggravated assault with a deadly weapon, definitions of firearms, as well as terroristic threat. Next slide. Perfect. And so another large part of the bill is student records and data sharing. So this is not everything that's in the bill related to this, but just a few highlights. So it ensures that parents and guardians are able to receive access to their student records upon request, and it denies local boards of education from having policies that prevent parents from reviewing their students' records. It also requires that schools receive complete records of transferring students, and it requires parents to disclose critical information to the transferring school related to the student's behavioral or criminal history. It also allows schools to inform teachers if a student assigned to them has a criminal history. It requires law enforcement officers who have had an encounter with a school-age child to report that incident to that child's school within 5 days. And it requires school boards to promote parental involvement in public schools, including promoting parents to review their student records, review kind of their school curriculum, and creates procedures for if a parent has any objections to what their child is being included, what's being included in the child's curriculum. Next slide. So, this is the piece that I really want to focus on. It is the mental health and behavioral health services in schools portions of the bill. And so, several things. First, the bill provides grants to local school systems to reimburse for one or more qualified student advocacy specialists. And so, the student advocacy specialist is a new position which will serve as the care coordinator and resource builder for students who have been identified to have mental health needs. Um, the student advocacy specialist does not provide direct services to the student. So, historically, this kind of role may have been housed in a school social worker or a school counselor sort of role, but this is going to be a completely separate role where their job is to provide care coordination and not direct services. And there is $7 million in the budget for this role. The next is the bill encourages schools to implement Tier 1 and Tier 2 positive behavioral interventions and supports programs with guidance from and lessons approved by DBHDD, as well as response to intervention programs in their schools. It also requires that 95% of school personnel receive behavioral health awareness training with those lessons approved by DBHDD as well. And there's $3 million in the budget for this item. So next, the bill requires that all public school staff and students receive training in youth violence and suicide awareness and prevention, and that is kind of guided by DBHDD. And it also requires that schools adopt policies that address suicide prevention, intervention, as well as postvention. In addition to that, it requires or encourages that schools create a student-led and staff-supported violence prevention club that is open to all students. The next thing is that it requires school safety plans to specifically address the behavioral health needs of all school personnel, and that is to be guided by DBHDD again, and as well as develop a behavioral threat assessment plan. And so, to give a little bit more information on the behavioral threat assessment, when it's operationalized, it is supposed to help identify a child that may be showing signs of early stress or mental health needs, and it pulls together a multidisciplinary team to identify supports for that student, as well as decreasing the risk that the child could potentially become a threat to the safety of the school. And then lastly, it requires the establishment of a statewide alert system for school communities to report threats. And the behavioral health aspect of this is that it creates procedures to follow up with the parent or guardian of any child that has been added to that alert system in order for them to be connected to behavioral health services. So, in terms of where we are with HB 268 implementation, specifically as it relates to DBHDD and their role, so DBHDD is in the process of defining the role of the student advocacy specialist. They are charged with not only overseeing the grants for schools, but also defining what the student advocacy specialist role will actually entail. And that is set to be complete by the end of this year. So December 31st, 2025, the student advocacy specialist role should be composed. They're also responsible for reviewing and providing input on school safety plans. And they're in the process of reviewing standards to guide schools, and they are creating a submission and feedback process so that there are multiple there's multiple stakeholder feedback involved in creating that guidance, as well as they're responsible for providing training and technical assistance to school systems and agencies regarding behavioral health topics, including suicide prevention and behavioral health functions of the threat assessment. And these last two items are set to be complete by January 1 of 2027. Next slide. And so I know that's a lot. There's a lot included in the bill. So if you're interested in kind of learning more, going a little bit more line by line, Mindworks has put out a brief on HB 268, we talk about the significance of the bill. We break it down by each section. And Alex also put the link to that in the chat. So, yeah, now I'm happy to take any questions.
Thank you so much, Courtney.
I have a question. Can you all hear me okay?
Yeah.
Yes.
There was a slide that referenced the criminal history of students that I believe it said teachers would have access to that. Can you go back to that slide?
Yes. Give me just 1 second to pull it back up.
Okay. My question was around I'm assuming the criminal history is felonies, that any student who has felonies, that teachers could be made aware. Is that right?
Yes, that's right. That's on the student, yeah, data sharing slide after this one. There it is. Bullet 3, yes.
And so I'm curious as to what is the rationale behind that? Because, certainly coming from education, I could see that that would cause a storm of concern, perhaps even some mistreatment to students, or a desire to try and take students to a disciplinary hearing to put them out of school. Um, and so I'm just curious if you know, like, what the rationale is for that. I can understand if it's, a dangerous felony, but just a criminal history, period.
Yeah, so I can't speak to exactly what the rationale is. I can say that there have been concerns raised consistently regarding this and sort of yeah, what you're saying, wanting more of a detailed like what exactly is considered a criminal history. Is it just violent crimes? Is it, and that's not specified in the bill. And I don't know if Ashley wants to add anything, but I did just want to share that that is something that we have heard come up several times as a concern. Ashley, do you
Mhm.
want to add anything?
Yeah, I would just say it has come up. I think that the rationale that was spoken about during the making of the bill is that it was their intention that this may make teachers aware to just, and this comes in the concern, I'm trying to think of the proper wording, that if they start to notice signs that they can identify it sooner, because the incident that happened, there was previous history and there was a sentiment in the Georgia legislature that perhaps if the school had known about that, they would be able to have intervened or helped sooner. So I think that is some of the rationale behind it. But of course, it's not a perfect process. So that was some of the conversations happening.
Wow, I am concerned about that one, especially considering the fact that most school districts already have it written into their code of conduct that they can take students to a disciplinary hearing to have them put out of school if the school can prove that they have a felony and that there is a potential nexus to harm for the school or any of the students or staff. So that is concerning, but thank you for that.
Thank you, Shannon. Lynn added in the chat, in addition to suicide prevention training, our teachers and staff offer trainings to learn more about ACEs and how they can connect to student behavior. Teachers, staff, and students would benefit from community resiliency model training too. These skills would be helpful in a safety event.
Yeah, thank you for that comment. So I know that DBHTD is working on that, kind of what is included in those trainings. I'm not sure of the specifics of what they have talked about, of what will be included, but I do know that they are like hearing feedback. I don't know exactly what that process looks like, and I don't think it's been completely fleshed out yet of how the feedback will work, but I know that it's going to be um, possible to submit feedback.
Hey, Courtney, it's Andrea. Just a follow-up to that, would it be possible to be invited into some of those conversations to help discuss how our regional coalitions could be a support network for some of the training that's going to be required across the state? Do you know?
Ashley, do you have more insight into that?
I don't know the process. I would say Dr. Doyle, Chrissy Doyle, is leading these efforts, and I don't think it would hurt to maybe send like an email and ask.
Yeah, and I can drop her email in the chat too, just so we all have it.
That's great. I was wondering who the main contact was. I feel like we have contact with her already. And I guess as a former coalition lead and a statewide worker now, I just foresee the schools need to know what their resources are locally so they don't feel immense pressure to find and pay for things that maybe could already be offered to them from our regional work. So I just wanted to make sure we're there to help in any way we can.
Yeah, that's a great point, Andrea. I'm sure our team would be happy to follow up with Chrissy and then connect anyone who, connect folks back to the regional coalitions once they start planning that out. Somebody said, could you drop the link to the policy brief? Oh, okay. Yes, I can do that. Oh, there it is. Thank you, Audrey. And then I believe Susan asked, oh, maybe it's not there anymore, but I know that there was protocol for when law enforcement is involved. And our regional coalitions talk about, it's called Handle with Care. It's like a protocol model for children who have, come in contact with law enforcement, whether, the night before or that day, where they're then, handled with care. So the school is alerted. And then from there, they just make sure that there's, very minimal information shared with teachers and everybody, but just to make sure that if they are showing signs and symptoms of just being like, lethargic or maybe acting out a little bit more in class, to really just try to handle them with as much compassion and kindness. And then if there is additional interventions needed, they're able to refer them without re-traumatizing them, basically. I didn't know if there was if that conversation around that protocol has happened, or if this is the first you're hearing of it.
Yeah, so I don't know about conversations outside of what's written in the bill. I know that that's not specifically called out. It's just, there's a requirement that if a law enforcement officer has an encounter with a school-age child, that within 5 days they have to report it to their school. And the other thing that I do want to say is that when legislative session starts again for year 2026, like these are going to be continued conversations. Like they're not done talking about school safety and school climate. So I think there's definitely opportunity to voice any concerns with what is included in the bill currently, what we want to see going forward. So yeah, Ashley, I don't know if you want to add anything.
I would just add, Alex, that I believe in tandem with Dr. Doyle's group, who's working on the school, the student Courtney, please remind me the name. Sorry.
The student advocacy
Yes, the
specialist.
student advocacy specialist. Thank you. There is another group that's working on the school safety issues with school resource officers and getting feedback. And I believe that is some of the people who were in the school behavioral health BRIC working group. We don't have all the details of that group, but I would just maybe also ask her about that because she would be the one that could plug you into those conversations that are happening.
Okay. Awesome. Yeah. Does anyone else have any questions for Ashley and Courtney? Any other recommendations or suggestions for, that align with this bill that we could also share when we're reaching out to Christy? Lynn said maybe Handle with Care could coordinate with the qualified student advocacy specialist as well as the team coordinating with law enforcement to meet the mobile panic alert requirement. Yeah.
Yeah, we'll definitely follow up with Christy Doyle. I know that she was also really interested in Handle with Care. And we're I don't know if she's connected with Lizanne yet, but those conversations are also happening. Um, Thank you. This is so much information. So thank you so much for sharing all this. I feel like I have to really just absorb all the different things. With the behavioral health threat assessment sort of process, so is it GMA that's supporting schools in, I'm just trying to understand what the process is. Like who is supporting schools in developing that piece?
So it's a collaboration between GMA and DBHTD. DBHTD
Okay.
is providing kind of guidance on the behavioral health aspects of the behavioral threat assessment. And one thing Christy Doyle mentioned is that that's a new task for DBHTD. Historically, they haven't been involved in that process. So that's a positive, I think.
Yeah, yeah. So it's like a lot of development and learning through this process, right?
Yes. Yeah. And as I mentioned, they're in process, right? So this is Christy shared that this is something that's going to be expected to be rolled out in 2027, and so it's in the process of being developed. So I don't know exactly what it's going to look like at this moment.
Got it. Thank you.
And someone asked if there was a draft job description or criteria for the student advocacy specialist.
Go ahead, Ashley.
No, that's fine. I was going to say that is what Dr. Doyle Chris is working on at the moment. It's in the process of being drafted. So I think more to come. I know that's a high priority. So
yeah, and she did share that that would be done and drafted by the end of this year. So December 31st, 2025.
Awesome. Andrea, did you have another question?
I did.
Okay.
I didn't want to hog the space, but have y'all heard any conversations about new legislation that might add on to this bill or update any of the more nebulous parts of it to help define things a bit more or clarify? My thought was just, kind of the question that was asked initially about tracking students' criminal history. There's a fine line between being trauma informed and being weaponizing trauma informed care. And I feel like that training would be helpful to schools to understand it can be used for prevention and early intervention, but it can also be used for harm and bias. And so I'm just wondering if there's any conversation around that.
The conversation that I have heard happening in the BRIC meetings or just around this bill altogether is that they're not done with the conversation. So not specifically that new legislation will be introduced or if they will be editing what they passed last year, but the topics that have come up from different spaces are the data sharing portion specifically. So I know that they want to go back and revisit that. I don't know what that will look like. And then also the topic that was brought up today about criminal history is one that has continued to come up. I don't know how open the legislature will be to that conversation, but I know that it's something that has come up multiple times. But it will definitely be a topic again this session by what legislators are saying.
Is that mostly happening in the Child and Adolescent Committee, or is it happening in the other BRIC committees? Just curious.
Child and adolescent, and then I know that the last time the school-based behavioral health one met, which was a while ago, it came up in there, and then I attend so many committee meetings, I can't remember the other place that it's happening, but it's like percolating at the top, and anything really related to children and adolescents and this bill where the conversation has come up.
And for anyone who is not familiar with the BRIC acronym, I put that information in the chat for you.
Yes. So like last meeting, Dr. Doyle presented on the implementation of this as well, which is where Courtney got a lot of that information from. So it's just a conversation that's happening in different places.
Yeah, definitely. Anybody else have any questions? Anything they'd like to add?
Well, just a thought that maybe we can encourage the conversation around that bias versus trauma-informed care to be part of the approved trainings.
Yeah.
Because I think that will become an issue. Even with good intentions, it might be misused. So
Yeah. Alrighty. Well, thank you again to Ashley and Courtney for presenting this legislation and informing us further on the updates that you have. And, we just look forward to staying informed, and we'll, keep in touch with you guys and vice versa. If you have anything that comes up that you can share with us, please let us know. I'm going to drop a lunch and learn survey. I always forget after every one of them to say that before we hop off the call. So please fill that out. It's just a brief survey. So we can continue these lunch and learns and know what you guys are interested in hearing more about. So with that said, we will give you back more time to your day, and we hope you all have a wonderful rest of your week.
thanks, y'all.
Thank you.
Thank you.